Steve Fagen in 2002 said traditional approach to the upper blepharoplasty has remained unchanged. This is the Mayo Clinic draw in 2021. Rodriguez said unsightly result and be more conservative, 2004. This photo was taken from the internet and it was published as the most advanced laser blepharoplasty, and you can see almost no skin of the eyebrow was left and the resection extend beyond the external canthus, pulling down the eyebrow tail. Ambroise Paré in the 17th century began to emphasize the importance of avoid over-resection, and you can see now the last advance of the blepharoplasty with laser technology, almost cutting with laser technology, almost do not left skin of the eyebrow. Rodriguez in 2018 said, be more conservative, limited resection. Fourth controversial concept, I propose do not remove skin at all. Since 1994 to the present, I performed near 3,000 periorbital rejuvenation without skin resection. I'm sure the future of periorbital rejuvenation will be skin tightening and skin rejuvenation instead of skin resection. For me, any degree of flacidity of the periorbital area can be tightened with the energy of carbon dioxide laser. Only adequate energy must be used. This is one of the patients that I'm going to present in this presentation. In 1998, in the Argentine magazine of plastic surgery, I present 4 years of experience with transconjunctival blepharoplasty and carbon dioxide laser. In 2017, I presented global perspective blepharoplasty, and the name was Blepharoplasty without skin resection. The president of this sub sent the congratulations for the contribution to the science and invite me to present in Miami, sub Miami 2018. Ohana Hai described transconjunctival upper lid blepharoplasty in 2005. Since 1994, I'm using this stab incision in the inner part of the upper eyelid. I think maybe another medical doctor or plastic surgeon describe this stab incision. I'm sure of this, but I didn't see, and I imagine that this will be useful to remove the upper, inner and lateral fat pads. Through this small incision, I remove the upper eyelid fat pad. I use a transconjunctival blepharoplasty, and here in the intersection of the two arches, like described Bourget and Sarin. This incision is wide enough to see the entire anatomy. Nor the upper eyelid stab incision, neither the transconjunctival incision are sutures. Here we can see that through this stab incision we can remove all the fat pads we need, and also we must to be careful, don't produce a sunken eyelid. Physiological blepharoplasty, this is 7 days after the procedure. We can see almost no visible scars. We can see the skin, the shrinking and the rejuvenation. Also, this is 7 days. Roberts in 1998 said, although blepharoplasty has long been the traditional method of improving the aesthetic appearance of the eyelid area, it yields little improvement in several of the major signs of periorbital aging. I think Robert referred to this situation. For me, conventional eyelid blepharoplasty cannot improve wrinkles of the infra-brow and lower eyelid skin, crow-feet wrinkles, malar festoon, creepy changes in the periorbital skin texture, pigment spot and other actinic damage, elongation of the vertical height of the lower eyelid, and this is also more important, loss of the gentle indistinct transition between the lower lid and the cheek skin. I'll call this presentation physiological periorbital rejuvenation because I'm talking about upper eyelid, eyebrow, periorbital area, lower eyelid, malar area. For this reason, it's periorbital rejuvenation. And I talk about physiological rejuvenation because we are going to see why the name today for the technique I propose is physiological. How the skin of periorbital area age. Histologically, the epidermis, dermis and hypodermis are affected. We can see tissue atrophy, vascular and pigmentary alteration, folds and furrows. We can compare the skin with the desert land that is drying for the pass of the year and the effect of the sun. And we need to nourish the land and we need to nourish the skin.